Living with phenylketonuria, or PKU, presents unique challenges in managing phenylalanine levels. For years, patients and healthcare providers have sought more effective treatments. Today, we explore a significant advancement in PKU management. Phenylketonuria is a rare genetic disorder. It's caused by a mutation that impairs the body's ability to process phenylalanine, an amino acid found in protein. Without the necessary enzyme, phenylalanine builds up to toxic levels. This accumulation can lead to severe brain damage and other neurological issues if left untreated. Effective management is crucial for preventing these serious complications. Sephience, pronounced Sephience, is a prescription medication. Its generic name is sepiapterin, and it comes as an oral powder for reconstitution. Sephience is specifically designed to help reduce elevated phenylalanine levels in the blood. It represents a new therapeutic option for individuals living with PKU. The active ingredient in Sephience is sepiapterin. This compound acts as a phenylalanine hydroxylase or PAH activator. It employs a unique dual mechanism of action. Once ingested, sepiapterin is rapidly converted into tetrahydrobiopterin. This form then activates the PAH enzyme, which is responsible for breaking down phenylalanine. Beyond activation, sepiapterin also helps prevent the PAH enzyme from misfolding. This dual action improves the enzyme's overall function, significantly enhancing the breakdown of phenylalanine in the body. Sephience is FDA approved for the treatment of hyperphenylalanemia, or HPA. This includes both adults and children as young as 1 month old. It is specifically indicated for those with sepiapterin-responsive PKU. Importantly, Sephience should always be used in conjunction with a phenylalanine-restricted diet. The effectiveness of Sephience was rigorously evaluated in the Affinity clinical trial. This Phase 3 randomized, double-blind, placebo-controlled study demonstrated compelling results. Patients treated with Sephience experienced a remarkable 63% reduction in blood phenylalanine levels after just 6 weeks. In contrast, those receiving a placebo showed only a 1% reduction. These positive outcomes led to Sephience receiving FDA approval on July 28, 2025. This approval followed the successful completion of the Affinity trial and its long-term extension study. Sephience is taken once daily with food. It is crucial to follow your healthcare provider's exact instructions for dosage and administration. Your provider will determine the appropriate dose based on your or your child's weight and age. Always ensure more food is consumed after the dose. Sephience comes as a convenient oral powder in individual packets. For doses less than 1,000 milligrams, mix the powder with water or apple juice. For doses 1,000 milligrams or greater, you have more options. The powder can be mixed with water, apple juice, strawberry jam, or applesauce. Always refer to the detailed instructions for use provided with Sephience for precise preparation guidelines. Before starting Sephience, it is vital to inform your healthcare provider about all your medical conditions. This includes any existing health issues or concerns. If you are pregnant or planning to become pregnant, discuss this with your provider. It's not yet known if Sephience can harm an unborn baby. Similarly, if you are breastfeeding or plan to breastfeed, consult your healthcare provider. It is unknown if Sephience passes into breast milk. Your provider can help determine the best feeding method for your baby while on this medication. Like all medications, Sephience can cause side effects. The most common side effects, occurring in 2% or more of patients and greater than placebo, include diarrhea, headache, and abdominal pain. Other common side effects are hypophenylalanemia, yellow or orange stool, and throat pain. These are generally mild but should be monitored. Serious side effects can occur. Sephience may increase your risk of bleeding. Report any symptoms of bleeding to your healthcare provider immediately. Symptoms of bleeding can include unusual bruising, red or purple skin marks, or bleeding that lasts longer than usual. Menstrual bleeding that is heavier than normal should also be reported. Another serious side effect is low blood phenylalanine or hypophenylalanemia. This is common during treatment and can be severe. Your healthcare provider will monitor your levels closely. This is not a complete list of all possible side effects. Always contact your doctor for medical advice regarding any side effects you experience. You can also report side effects directly to the FDA at 1-800-FDA-1088. It is crucial to inform your healthcare provider about all medicines you take. This includes prescription and over-the-counter medications, vitamins, and herbal supplements. Sephience can interact with other medicines, potentially causing side effects or altering their effectiveness. Other medicines may also affect how Sephience works. Be sure to keep an updated list of all your medications. Share this list with your healthcare provider and pharmacist whenever you receive a new prescription. Specifically, tell your healthcare provider if you are taking medicines containing levodopa, antifolate medicines, or other medications used to lower phenylalanine. Also, mention any medicines used to treat erectile dysfunction, such as phosphodiesterase 5 inhibitors or PDE5s. This is not an exhaustive list of all possible interactions. Always consult your healthcare provider for personalized advice. If you or your child misses a dose of Sephience, take or give it as soon as possible. Do not take 2 doses in a single day. Simply continue with your normal dosing schedule on the following day. Consistency is key for effective management. Proper storage of Sephience is essential for maintaining its effectiveness. Store the oral powder packets at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Once Sephience oral powder is mixed with water, apple juice, strawberry jam, or applesauce, specific storage guidelines apply. If the mixture is not taken immediately, cover it. You can store the mixed solution at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Fahrenheit to 25 degrees Fahrenheit for up to 6 hours. Alternatively, you can refrigerate it between 36 degrees Fahrenheit to 46 degrees Fahrenheit, 2 degrees Fahrenheit to 8 degrees Fahrenheit for no more than 24 hours. Before administering a stored mixture, stir it thoroughly. If prepared with water or apple juice, stir for 30 seconds or more. If prepared with strawberry jam or applesauce, stir for 60 seconds or more. Always discard any unused mixture after 6 hours at room temperature or after 24 hours if refrigerated. Keep Sephience and all medicines out of the reach of children. During treatment with Sephience, regular checkups with your healthcare provider are vital. Your provider will conduct blood tests before and throughout treatment. These tests are crucial for monitoring your blood phenylalanine levels. Based on these results, your healthcare provider may adjust your dose, temporarily stop, or permanently discontinue treatment if certain side effects occur. Your healthcare provider may also recommend changes to your diet during treatment. It is imperative to follow their instructions precisely. Do not make any changes to your diet without first consulting your healthcare provider.